Hello and welcome to the Amplifying Scientific Innovation video podcast. I'm your host, Dr. Sophia Onoye, founder and CEO of the Sophia consulting firm, a life science marketing and communications consultancy that was established in New York City with the goal of amplifying scientific innovation. The goal of this podcast is to showcase scientific innovations stemming from global life science companies through conversations with senior leaders who share a unique leadership journey, corporate vision, and industry outlook. My guest today is Laurie Cooke, President and CEO of the Healthcare Businesswomen Association, or HBA, a nonprofit organization dedicated to furthering the advancement and impact of women in the business of healthcare. Under her leadership, the HBA has grown substantially to a community of nearly 60,000 members with more than 50 HBA locations and members from nearly 30 countries. Lauries Career spans global roles across several industries and continents, holding executive roles on the Project Management Institute's PMI executive management team, international teams and process improvement, team effectiveness, and project management at notable healthcare organizations, inclusive of Aventis Pharmaceuticals, Inc., in addition to hospital pharmacist roles in Seattle, Washington. Now, I'm not quite done yet. Laurie graduated with a degree in microbiology from the University of Maryland and received an advanced scientific degree in pharmacy from the University of Washington and a master's degree in software engineering management from the University of Luton, England. She's a licensed pharmacist and a certified association executive. Now, I had the pleasure of meeting Laurie in person pre-pandemic, almost a year ago, at the Pfizer corporate headquarters, where she interviewed the CEO of Pfizer, Dr. Albert Bourla. I simply cannot say enough about Laurie's visionary leadership and her ability to mentor and sponsor so many women in the healthcare industry, including myself. It's truly an honor and pleasure to know you, Laurie. Welcome to the show.
Thank you, Sophia.
It's nice to have you here, Laurie. You know, I've been looking forward to this moment for a while now. So my first question is probably my favorite, and it is, what is your definition of scientific innovation?
So I always like to break things down to the simplest and core nature. And so I'll start with innovation, which is really pretty basic. It's something new or different. And really, when you add the word scientific, I think that merits to add the industry context to it. Mm-hmm. So when you have scientific innovation, it really is the core of our industry, right? The mm-hmm. healthcare and life sciences. And we would be nothing if we did not have our scientific innovation as the precept for everything we do. So simple in its definition, but so powerful in terms of its impact.
Right. And the beauty of what you said is that you actually hit the nail on the head. It's about impact at the end of the day. And we measure ourselves by how we can transform people's lives all over the world, correct?
Totally. And I think if I embellish it a little bit, when you think about, I heard a wonderful webcast where they talked about innovation and it being the intersection between when you have invention and insight. And this is why I think diversity of thought is so important here, because if you have a diverse team, something that you see and it seems pretty ordinary, and then you've got someone who's had a different life experience than you, and they see it and they offer some perspective, and you know, all of a sudden you've got that eureka moment where you go, I never saw it that way. So please, organizations, realize that if you want innovation in your company, you've got to have diverse teams.
There you go. And I couldn't have said it any better myself. I love what you showcased about the importance of diversity of thought. It comes from different people from multiple backgrounds, multiple genders, ethnicities, etc. So thank you for highlighting that. Now, obviously, I could spend 5 more minutes just talking about your great accomplishments to date. But what would you consider to be your most impactful professional accomplishment prior to becoming the president and CEO of the HBA?
Those are always interesting questions, and you you look back and you think on your career, I did think it was when I was doing development of anti-infectives, and I was working on anti-infectives that were truly life-saving kinds of products. But it was when I moved into a new role where I was working with the companies, where we were having these mergers, and we would have the French and the Germans and the Brits and the Japanese and the Americans, and all of those mergers of companies. You merged because you wanted the best of that new company, but you can't just push people and their their adherence to their processes and the products they've been developing that sometimes got put on the shelf, and now you want them to work together as happy families. And my job was to help get this is in the days of the blockbusters, and I had to get the late stage teams to market for global submissions as fast as possible. So that's when I realized this, while process is important and, these great ideas, et cetera, if you cannot get people to work together and value each other, you really are not bringing the full force of what you've got, which is your people, to the table. And that's where I think I found my niche in terms of trying to understand people and help other people understand people. And then before you know it, they found a new home and a new family.
Right. I think it's remarkable that you were working in the anti-infective space before it became the cool thing to do as a result of COVID. I mean, that shows how forward-thinking you are. And you also understand the importance of collaboration and proper team dynamics. So really, thank you for sharing that. So now I'm curious about something else, right? Why did you choose to join the HBA, and how close are you to achieving your vision for the HBA?
Well, I chose to come to the HBA, I think, because with every role I've taken, and I encourage other women to think about this, when you take a new role, you want to have a good portion of that role to be something where you can develop. So don't just walk from position to position where you know how to do the job. You're always looking to develop yourself. And so what I looked for in the roles that I took is whether or not I could increase my impact. So I went from being a microbiologist, where you're trying to figure out what one patient has, the cause of the infection. And then as a pharmacist, I was helping all the folks, at my hospital, and then moving into drug development, where now I'm developing an anti-infective that could solve and become the answer to something that was currently not being treated or treated as well. And then I moved into nonprofit, where I was advancing a profession, and it happened to be project management, which is helping all industries to do things better, faster, et cetera. And it was when I had this opportunity, which is they were looking for, hopefully, a female who understood the global environment, who understood healthcare and associations, and had that level of make it happen. It was, I have to do this, because now I'm actually helping half of the world's population, right? When you start working at trying to bring women forward. So I thought it was a beautiful marriage, and I couldn't say no. And all I can say is all I was doing was bringing my passion and applying my learnings, and the soil was already there. It was beautifully rich, and I cultivated it and just helped nurture what was sprouting up. And I take great pride in it, but I'm definitely, I am on the shoulders of some amazing women that have come before me at the HBA, and that gives me great pride to keep that advancement going on. And you're one of those women at the HBA, and it just makes me so proud to see everyone progressing in their careers.
No, that's great. I think it's something really remarkable about the organization itself. I've never quite experienced anything like it in my life. Now, I'm curious about your vision for the HBA. There's a gender parity collaborative that you had formed. You've done so many great things, but how close do you think you are to achieving that vision that you had?
Well, 2 years, our vision is to achieve gender equity and parity. So unfortunately, it's not moving as fast as we would like. However, it is actually improving. And I think this year's McKinsey study, they do women in the workplace, and the HBA is an industry partner champion with them. And McKinsey showed that in senior management levels between 2015 and 2020, women in senior VP positions grew 5%. And 5% doesn't seem a lot, but we were like barely growing at all. So we've been growing on a steady, 5%. And the C-suite grew another 4%. So we are definitely moving forward. I think my vision for the HBA is we moved from helping individual women to starting to work more at the company level, because what we were seeing is women were, there's nothing wrong with the talent pipeline, and we have so many qualified women, but they were really getting stunted and frustrated in the companies they were working in. So we realized, what if we started working with the companies? And it's when we did that things really started to crack. The ceiling, watch out, ladies, put your shoes on, because there's a lot of glass on the floor, because we are breaking through.
Yes.
And it's really working. So our collaborative started 2 years ago. And the companies that are in the collaborative have on average 12% more women at all levels than the industry standards. So we definitely are making progress. We're not there yet, but we are, making the kind of progress that keeps you motivated to get out of bed every day.
Absolutely. And it wouldn't be a vision if it was something that you could achieve overnight. So I think that those sequential steps that you're making, it adds up really, and it really does make a difference. Now, I'm curious to know if you could provide us with a top line overview of other work that is being done at HBA and how it ties into your Lunch with Laurie series.
My Lunch with Laurie series, I love. We just started that, and looking forward to you having lunch with me.
Yes, I'm excited.
Well, what we were trying to do at the HBA and with the Lunch with Laurie is, we at the HBA go across, we're very broad, and we do that very strategically. So across the full spectrum of a woman's career, functions, industry, sector within the healthcare and life sciences, geography, et cetera. And the concept here is that if we work together, we're going to be more powerful. We can really link arms, and we can learn from each other's perspective. So if you think about Lunch with Laurie, one of the things we were doing is trying to bring in front of our membership a leader who has perspectives that can challenge people to, perhaps, I hadn't really thought about it that way.
Right.
That's sort of where you tilt your head and you think about it. And that's what we want, because that's when the light bulbs start going off. That's when people start to recognize it's within their reach.
Right, that's really remarkable. I'm very excited to be on part of the series, but most importantly, again, just the HBA is growing wings. And I think amid COVID-19, there's so many opportunities to collaborate with other branches, other locations, like not just here in the US, but in Europe as well. So that's really remarkable. And thank you for sharing those perspectives.
You're welcome.
So in your opinion, as we shift gears a little bit, what are some unique challenges that female leaders face, and how does the healthcare industry compare to others from a diversity and inclusion perspective?
So first of all, when I look at the barriers, I'll call them barriers just for the moment, because quite often barriers are opportunities, aren't they? Just looking at it in a different way. It's not barriers from women themselves. It tends to be other people and organizations. So the inherent bias in people and the processes in an organization where perhaps women are not seen as suitable for leadership positions because it just hasn't been done before, at the level. So one of the things I think is we do not track capture data, track it, analyze it to really know what's going on. People look around, they see visually, and they say, oh, like my team's good. And really, it's not. When you start to peel back and look at the data, it's not. So I think one of the things that is not going well is we don't do enough at really understanding the data. I think the second thing is women tend to be excluded from the more informal networks. And now you don't know about a new job coming up, less people, the people in the room that are going to stand up for you, the sponsors, so to speak. I think when women are reviewed at appraisal time or compensated, it is not done in the same way or using the same balanced scorecard, so to speak, between women and men. I mean, just think about some of the word choices people use for women and men, and you start to see the bias in there. One thing I do talk to mentors quite a bit about is I don't think women have access to the same experience and education that men do. And I will ask a mentor, who are you mentoring? And, they quite proudly say, men and women. And I say, well, what are you mentoring them on? And when they start to compare and think about the men they're mentoring and the women they're mentoring, they realize they tend to mentor women on things like, how to speak up and at the table and confidence, et cetera. And they're not talking to them about strategy and business and finance. And those are the things that are the barriers for women getting to those senior levels. So I think that realization was a big one for many people. And then the last but not least, which is managers are simply not held accountable for supporting diversity and developing and advancing women. And when you see that held, so looking at data, holding them to it, making sure you have equal reviews, et cetera, that's when you see a major shift in the numbers of women as well as the performance of the teams on those balanced teams.
Well, that's extremely well said. Thank you so much for outlining the issues and thinking about practical solutions. I think that in my business school class, we were asked to read a book called Women Don't Ask. And what was interesting, it was about the amount of money, I think over $1 million that women lose in their lifetime because they don't like to negotiate. And so to your point, I think it's about going away from how to dress for an interview and really thinking through about strategy, negotiation, just more practical elements that can help you succeed.
Agreed. And then your point on how the healthcare industry is doing, we are actually one of the top performers when you look at the numbers of women and how they're progressing, which is not a good thing because we don't think we're good. But I do get calls on a regular basis saying, "Oh, how are you doing it?" So yeah, I would call us reasonable. How's that?
Good. So sticking with the healthcare industry for a little bit, how do you think that the industry has changed in the past 15 years and what are some loopholes?
Well, I mean, so much has changed in the healthcare industry. Thank you to scientific innovation. So I think on that front, that has changed dramatically. What I am seeing now, if we think about, I'll do it from the angle of diversity and inclusion, is that there is an awareness now of the amount of benefit that having more women and diverse teams are bringing to a company. And because of that, there's more investment then into looking at the organization and trying to make it a more equitable environment. That was being sort of looked at and a lot of money was being put into it, but I don't think we are putting our money and efforts into necessarily the right things. And I think when a company, so a quick example of that, if you put in place a lot of, let's say, flexible care options, work-life balance things where you can take time off or what have you, and then you ask people, so the company says, okay, box ticked. But then when you ask how many people are actually taking advantage of those programs, they're not, because they see it as, if they do that, it's a career limiting move. It's going to look like they don't want to get ahead. They're not ambitious. They don't want it as much as their male colleague. So if a company does invest in that, which is great, and we encourage that, what they have to do is the second part of it, which is to make it the norm, to show that you can do that and progress. You know, you don't have to look like everyone else that got promoted, you know, and so that's what I'm starting to see companies do, is look at the actual results, not just do the box tick. And that's why I think you are seeing probably people feeling they can step up and take advantage of what the company put in place.
Yeah, and it ties back to your original definition of scientific innovation and how you emphasize the importance of impact. And I think if people take a step back and they think about their work, are we creating value? In fact, not just creating value, but maximizing value and providing opportunities, not just for ourselves, but for others. So thank you so much for that. Now, based on your background, and I'm sure that you probably have one or two things that you could share, but what advice would you give young people in STEM, especially women who may be interested in joining a biotech or pharmaceutical company?
And I do a lot of this. And so I think I don't tend to actually have tremendously different advice to women in STEM, because I think there are some basics at the early stages that all young aspiring women can do. And so I do offer this guidance to women in STEM. And I came out of STEM and moved over to the business side. Is number one, mentors are great. They're wonderful. You should have them. But sponsorship is what's essential. You have to have senior leaders who know about you, know what you can do, and advocate for you when it's time for a promotion or perhaps an assignment that comes up. So definitely sponsorship is number one. Number two, I hear a lot of women talk about how hard they work and they're waiting for somebody to, you know, come and tap them on the shoulder and, you know, you've got the promotion. And then they see somebody beside them that is like, they work the field, they're like never doing, you know, not coming up with the deliverables. So it's not about working hard. That's par for the game. You need to work smart. You need to network. You need to be out there meeting people, strategically volunteering for roles that a senior person is going to have more visibility to you. So if you had an internal women's network or some team where you know there's a senior person on the team. So definitely work smarter. The third is speak up at meetings. You're invited for your brain. So if you say nothing, you know, you didn't add value. But the thing I take it to the next level is not just speak up at meetings. You need to get invited to the meeting. So you can do something like, if you have, you want to learn more about finance and you ask a senior finance person if you could shadow them at a few meetings. You now get to go to meetings you'd never been invited to, and you can see how they interact with each other. Those people see you, and you really show that you are creative, you're open, you're intelligent, and you're learning. So not only speak up at meetings, but get invited. The fourth one, I think I would go, because there's so many, I'm trying to narrow in. I would go for creating your own personal board of directors. And this is not just the type of people who are your fans, right? So that's great to have, and they support you and they give you feedback and they do it kindly and with good intent. But also you want people who are more senior, challenge you, maybe even being potential sponsors, and then get at least one critic in there. Somebody really doesn't think as highly of you, because if you can convert that person, not only is that going to be success, but you are going to likely learn more from that person and their criticism than anyone else. So definitely have your board of directors to help you along the way. And last but not least, as you start to move up, send the elevator back down. You will develop a reputation that you care about other people, and people will see that. They will want to be around you. And you always know, if you surround yourself with great people, you are going to have more deliverables, more successes, and be seen as who is that person who is just, they're always delivering, everybody wants to be on their team. So you look after people and they will look after you. So definitely send the elevator back down.
I mean, I feel like I should clap at this point, because the advice that you gave, I mean, honestly, I think any woman or any person really at any stage in their career, they could learn so much from that. And sending the elevator down is something that is so important, because I think maybe historically, like when I was growing up in Nigeria, it's almost like as a woman, you have to compete with other women. And now we're learning that we are stronger together if we can collaborate and help maximize opportunities.
Exactly.
There you go. All right. So my 8th question for you, now that I'm keeping track, is are there any technologies that you are currently excited about, and why?
Oh, I'm definitely excited about anti-bias software, that they are coming a lot of different product offerings, but generally speaking, just think job descriptions, or when you're having an interview or you're going through a promotion, that starts to pull out some of the bias within. They are showing not only are you more likely to get better candidates, you're getting broader candidates, because putting certain words into job descriptions starts to narrow in who your candidates are that step forward. So definitely loving that one. I think like Textio, I think it's called interviewing.io, Talent Sonar. Those are a couple of softwares that I know about, but I want to put a plug in for the software programmers. If you do not have diverse people programming AI, so if you have a bunch of white guys programming, and they're going to be great programmers, and but they don't have the life experience of what life is like for a woman or a woman of color, or a person who doesn't live in the US, or a person who has a disability, etc. So we really need to think forward on AI, or the kind of decisions and algorithms that get programmed in are not going to be diverse and inclusive. So we will not benefit later on down the pike. So let's at the front end start thinking about that. So that's my really, I think, a really important offer there to make sure we think about that.
Great. I mean, it ties back to your point earlier around diversity of thought, how it fosters innovation, how it leads to impact. And if we're not bringing in multiple perspectives into the room, then we're missing out on an opportunity to really innovate. So thank you for emphasizing that. Now, thinking broadly, what do you think are some key consideration factors that will be important for sustaining innovation in the life science and healthcare industry?
Well, we just have to sort of think about COVID right now. One is resiliency. We must remain resilient. We must collaborate. We must learn to, I would call it, pivot wisely. We need to not be afraid of failure. And we learn more from that. And then we have to have grit. And I don't know if you know the book Angela Duckworth wrote about grit, but that's where you've got passion and perseverance that keeps you in the game. So those would be the things I think we just have to keep on the front burner to keep that innovation going.
Great. There is hope for tomorrow. And that's something we can look forward to. So in closing, I just want to give you the floor to provide any additional thoughts or comments that you might have, anything that you forgot to mention. This would be a great time to mention it.
I feel like I've said so much. It is so exciting to have an opportunity to talk with you. I think my last thought will be something along the lines of, we talked about the financial benefits that organizations have when they have more women, especially women at the top. But I think what companies can realize with more senior level women is that it can actually change the organization's culture and have some really long-term benefits. So women are much more likely to embrace employee-friendly policies and programs, and probably a lot of that is because women tend to be the primary carer at home and doing the laundry, etc., and looking after the elderly parents. So they're more understanding on that front. They're more likely to champion racial and gender diversity, which means we're going to have more diversity, we'll have more innovation, and they're more likely to mentor and sponsor than men. So if we can have more women changing up the nature of our organizations, and I think the one thing to call out is the change we've seen in COVID times is the new superpower, which is empathy, right? It used to be seen as a weakness, and now empathy is like the thing in the greatest demand. And luckily, we as women tend to have that as one of our strengths. And now we can be super proud of it, and companies need it. So that's my closing words.
Oh, thank you, Laurie. Lead with your strength. And that is really a very powerful statement. It's been an absolute pleasure and honor to speak with you. And I can't wait to share this with the world. I'm sure that everyone will enjoy having an opportunity to showcase you on the Amplifying Scientific Innovation platform.
Thank you, Sophia. And thank you for all the work you're doing in this industry. You are a great asset to us.
Thank you. It's my pleasure. It's my passion. And with support from people like you, I know that the sky is the limit. So thank you again, Laurie.
All right. Thank you.
All right.